I'm Dr. Colin Phipps-Leong from Parkway Cancer Centre, Mount Elizabeth Hospital in Orchard, Singapore. I am a consultant in haematology and I specialize in treatment of blood cancers and bone marrow transplantation. So today I will speak to you all regarding the most commonly searched questions on the internet. Question 1. What is blood cancer and is it the same as autoimmune diseases? So blood cancers and autoimmune diseases are strictly different. Autoimmune diseases are not cancer, right? They are caused by antibodies against your own body. That is not cancer at all. Now, blood cancers is not one disease. They comprise many diseases, but the most common we can say are leukemia, lymphoma, and multiple myeloma. Common blood cancer in adults is acute leukemia, specifically acute myeloid leukemia or AML. The reason why we call it acute is because the cells in the bone marrow that are affected by the AML grow very fast and they replace the bone marrow with all abnormal cells very quickly, and this is why it's called acute. So patients become sick very fast. Now, these kind of acute myeloid leukemias need to be treated very quickly. How is acute myeloid leukemia or AML detected? So AML grows very fast in the bone marrow. Once it starts growing, patients usually have symptoms and they usually present with fever that does not go away. They present with weight loss that is not intentional. May present with spontaneous bleeding or bruising, feeling very tired, severe fatigue, dizziness and headache. Some patients even have very severe infections as the first presentation. Now, if patients present with these features, doctors always will do many blood tests. So actually in AML, one of the most common tests, which is the full blood count, can actually show leukemia cells present. Now, if we find that leukemia cells are present in the blood count, then we will move on to more specialized tests like bone marrow biopsy tulang sumsum. So number 5, what is stem cell transplantation? So stem cell transplantation for blood cancers is the process where we use stem cells to replace the patient's bone marrow, to replace the patient's blood cells and immune cells. Stem cell transplantation for blood cancers are used for patients with acute myeloid leukemia. So most adult patients with acute myeloid leukemia will need a stem cell transplantation. We use it for patients with lymphoma, where the lymphoma has come back, and we use it for most patients with multiple myeloma or myeloma, which is a different type of blood cancer. Now, stem cells can be taken from the patient themselves, which we call autologous transplant, and stem cells can be taken from other people, which we call allogenic transplant. The other people can be the patient's brother or sister. It can be the patient's father or mother or children. It can be someone who's not related, and it can also be from cord blood cells. The most important thing is that we are able to find a suitable match for the bone marrow transplant. So when we do stem cell transplantation for blood cancers, it is a very complicated procedure. The patients generally have to stay in hospital. They have to stay in very specialized rooms to minimize the risk of infection. Because what we are trying to achieve with the stem cell transplantation is to replace the patient's bone marrow and the patient's immune system. So for the period where the cells are growing, where the new stem cells are growing in the bone marrow, the patient's body defenses or immune system is very low. So these patients need to be very carefully taken care of. The reason why we do stem cell transplantation, especially in acute myeloid leukemia, is to increase the chance of cure. That is the reason we want to cure. So my advice to patients who are dealing with blood cancer, who have relatives or friends who are diagnosed with blood cancer, please know that there are many effective treatments for blood cancers. So if you, your family member or your friend has blood cancer, tell them do not give up hope. Like I said earlier, acute leukemia, there are many types. Lymphoma, there are many types. So diagnosis must be accurate. We can use all the treatment options that we have. Thank you very much for the questions, and I hope you have found this informative.